Hi, I'm Dr. T. Scrosian, and I want to talk to you about silent leaky gut or silent intestinal permeability. And this is a condition where a patient has lost their integrity of their tight junctions. So, large molecular weight food particles and medium molecular weight food particles are going through the gut and then triggering an inflammatory immune response that's systemic. So the key thing about silent leaky gut is the fact that the patient has no gastrointestinal symptoms. So many times the patient with silent intestinal permeability that's leading to their chief complaints will come in complaining of things such as depression or chronic pain or just overall general fatigue. Um, and this is really important because as a clinician, you have to really realize that these mechanisms can be due by things like intestinal permeability, and you have to kind of work your way backwards. So we know that when the tight junctions of the intestines open up, there's a possibility for something that's called endotoxemia. And this is where you have gram-negative bacteria in the gut release things like lipopolysaccharides that then get into systemic circulation. And this LPS breach into systemic circulation that is called endotoxemia can lead to a whole host of clinical mechanisms. Number one, it can activate brain inflammation. These LPS particles can cross the blood-brain barrier, turn on microglial cells, and you can produce neuroinflammation. And when this happens, the patient can have chronic depression, inability to focus and concentrate, and it's really their gut that is causing their chronic depression. And there's been some research studies done where they looked at patients that were unresponsive to antidepressants, and they tested them for intestinal permeability and then treated them for that, and they saw a majority of them dramatically improve. So this is a classic example of silent leaky gut really playing a role for something as common as depression. Another common mechanism is just chronic pain. So when these LPS particles breach the tight junctions of the gut and they get into systemic circulation, it creates an inflammatory cascade throughout the body. So many people have chronic pain. They have swelling and pain throughout their body, but many times what actually happens is the inflammation activates an area that's already injured. So if they had a torn ligament in their ankle, or if they had a tear in their lumbar disc or a past disc herniation, there's some injury there, the systemic inflammation will activate those injured areas more. So now the patient just thinks they have chronic back pain that's activated, or their ankle's always hurting, and they really think it's more of a mechanical issue, and it's not really related to leaky gut. So those are the concepts of silent intestinal permeability. And then the last major mechanism for it that we see is that this LPS particle creates inflammatory cascades that uncouples mitochondria throughout cells of the body, and then this leads to low ATP production, and then many patients that have silent leaky gut get chronic fatigue. So we'll be talking about things like silent leaky gut and how it's important for you as a clinician to be able to identify them in our Scrosian Institute gastrointestinal clinical strategies and treatment applications. We'll be going through the most critical things that you need to know as a practitioner. What happens when a patient comes into your office with a chief complaint, and what are the roles the gastrointestinal tract plays with it? Sometimes it's obvious, it's a GI issue that you need to address. Other times it's not obvious. It's things like depression, fatigue, and lack of motivation, lack of drive, chronic pain in somewhere of the body can all be actually related to a silent leaky gut or some type of gastrointestinal mechanism. We'll share all those with you in our course, and I hope you can attend. Thank you for your time.